Well, joining me now is Rupert Pearse, an intensive care doctor in a London hospital and representing the Intensive Care Society. Very warm welcome to the programme to you, and we hugely appreciate you taking the time out to speak to us here on Sky News. First of all, your reaction to those comments from the Mayor of London there.
I think the first thing is I'd like to fully endorse the public health message that Sadiq Khan has described there. We can control this virus if we follow the rules. And what I would like people in London and across the country to understand is that the NHS is here for you. We're dedicated, we're proud to be your NHS. But right now, we need to control this virus, so we've got the bandwidth to look after all patients who need our care, not just patients with COVID.
We're being told that the number of patients on ventilators has doubled in the capital since Christmas Day. Just tell us a little bit about what you're seeing in intensive care at the moment.
So we're opening up more and more intensive care beds all the time. We're pulling in staff from other areas to allow us to do that. Our most precious resource in intensive care is our intensive care nurses, who are incredibly highly trained and who are the final common pathway of delivery of all the intensive care treatments, the ventilators, the dialysis machines, and all the drugs that we use. Right now, we're having to dilute, as we say, that expertise to one trained nurse for 3 patients, and being pushed to go even further to 1 nurse to 4 patients in some places. And that means that we're having to fill those gaps with staff who aren't trained as intensive care nurses. In some cases, they're medical students or nurses from other areas, and even hospital consultants coming from other areas of practice to help us deliver patient care. Now, you can understand that means those staff aren't available to do their usual jobs, and that means other areas of patient care, which is less urgent, is going to suffer.
So let's be frank about it then. The standard of care, unfortunately, is much poorer at the moment. And of course, we're not even talking about those people presenting in intensive care or indeed accident and emergency with non-COVID problems.
So one of the most remarkable things I've seen this year is the absolute determination of NHS staff to deliver the best possible quality care they can. But I think it's obvious to anybody, but our ability to do that is being stretched to the absolute limit. And so it does become very difficult. I think the area of quality that's most affected right now is the fact that we're so focused on patients with emergency problems that we're not able to do as much of the planned care that we need to do. So things like outpatient clinics and elective surgeries are not happening in the way that they normally would. And those are people who need patient care as well.
How is the situation in intensive care comparable to the last peak? We heard the Mayor of London describing it, according to some of the practitioners he'd spoken to, as being comparable to a theatre of war.
There are lots of war analogies you could use about my experience this year in terms of how our lives have changed and the uncertainty that we're experiencing. I think the biggest difference between the first wave and the second wave for me is just how long it's lasting. In the first wave, we went from very few cases to a peak within 2, 3, 4 weeks. This second wave has been going on and on and on since early November, late October, and it doesn't look like it's going to stop until at the end of January, if we're lucky. And just maintaining this response for that period of time is proving absolutely exhausting for NHS staff.
And we hear from colleagues and people like you describing when they go home, many of them unable to sleep, many of them suffering from PTSD. May I ask you how you're coping, how your colleagues are feeling at the moment? How's morale?
Morale is often high. If you come into hospital, you'll see staff smiling and looking after each other and looking out for each other. The problem comes with resilience. We each get a hit, something bad happens, something that makes us feel sad, maybe a crossword that wasn't intended. And those things hit us much harder than they are normally. And people are going home, as you say, finding it hard to sleep, finding it very hard to relax. And that means they're still tired when they get up the next day to go back to work.
And just a final thought from you about those people, not just the people who've blatantly broken the rules, perhaps partied outside hospitals in the capital, but perhaps those people who tune in and watch the Prime Minister announcing that households shouldn't mix over Christmas and then continued to do so. What would your sentiment be towards those people and anyone who continues to think that they are above the rules?
Well, I would say we're all in this together. I have to socially distance too. I'm in lockdown too. All of my family are. My kids are being homeschooled. My father-in-law has had his major cardiac surgery delayed. The experiences of this are the same for the NHS staff as everybody else. But the solution to this pandemic is within all of our control if we come together as a team. We can control this virus like we did in the first wave if we follow the government rules in terms of the lockdown and just stay at home where we can. But perhaps one of the most important things is families shouldn't get together in each other's houses. One of the worst places for transmission of this virus is families getting together in different houses. That matters just as much as mingling in the high street or in shops.
OK, Rupert Pearse, intensive care doctor, please know how grateful we all are for all the hard work that you're doing and your colleagues, and we wish you the very best through this very difficult time. Thank you.